Hard times only reveals who are your true friends. And friend in need is a friend indeed. You can ask your friend to come on a party, everyone will just come. But when you are in problem, only very few, or perhaps one or two, they are coming to you on the hard times. And they, hard time tells the true friends. So coming to the lipoma, symptoms of the lipomas that are, I have told you that it can occur anywhere in the body, but they are situated just under the skin mostly, commonly in the neck, shoulder, back, abdomen, arms and thighs. They are soft to duffy, to touch, move easily with slight finger pressure, generally small, typically less than 2 inches or 5 centimeter in diameter, but can grow larger, sometimes painful if grow and press on the nearby nerve or contain any blood vessel. I have already told you the type which contain blood vessel is usually painful. So small round masses that are less than 3 inches in diameter, these are the symptoms. Lesions are soft and duffy, easily move when slight pressure is applied, and skin of the lipomas are generally not painful. Now, what are the causes? Unclear, but tendency to develop a lipoma is sometimes hereditary. Hereditary conditions like familial multiple lipomatosis include lipoma development. Genetic studies show relation between HMG1C gene, a gene related to the obesity and lipoma development. There is relation between HMG1C and mesenchymal tumors also. They tend to run in families, so genetic factors likely play a role in their development. Minor injuries do trigger growth of a lipoma called a post-traumatic lipoma. Link between trauma and development of the lipoma is not very proven and clear, and it is said to be a controversial subject. Other conditions are lipomatosis. It is a hereditary condition in which multiple lipomas are present on the body. Adipose dolorosa, Darkham disease, is a rare condition with multiple painful lipomas, swelling and fatigue. It presents more in women than in men, seen in the obese postmenopausal women, and average age for the diagnosis is 35 years. Then benign symmetric lipomatosis, that is called Madelung disease, seen in the middle-aged males. It always appears after alcoholism, but may be present in non-alcoholic male and female. But as the cirrhosis is more in alcoholic cirrhosis, so this condition is also seen in alcoholism and one of the complications of alcoholism. Here one can see lipomatosis, different lipomas on leg, on the shoulder, multiple lipomas, and this is adiposis dolorosa or Darkham disease. Here one can also see multiple lipoma on the arm, chest, back, legs. See. So this is called Darkham disease or adiposis dolorosa. Then benign symmetric lipomatosis, Madelung disease, as you can see the large lipomas on the back, front and arms, that is the Madelung disease. Now, risk factor of the lipomas are family history, obesity and insufficient exercise. In subcontinent, there is a ghee which is called desi ghee, that is also one of the factor which is notorious for causing lipoma, as the people, those who use this desi ghee instead of the oil and other cooking oil, they use this desi ghee and they are very prone to have this lipomatosis and lipomas. Now, the diagnosis, physical examination is the key of the diagnosis. Rarely, a tissue biopsy or FNAC, fine needle aspiration cytology is needed. Just at the first look, one can diagnose it very easily. Imaging like ultrasonography, CT scan, or magnetic resonance imaging for the deep lipoma can these investigation imaging help to diagnose that MRI has superior sensitivity of distinguishing it from the liposarcoma and show surrounding anatomy the spread of the liposarcoma also. Here one can see the ultrasonography that is very clearly showing the lipoma. Similarly, inside the muscle, this lipoma can be seen on ultrasonography and fine needle aspiration cytology from the lipoma. We take just a tiny material and then we do see under the microscope the nature of this lesion. If the fat cells are there, it means lipoma. And FNA of the hand lipoma, that is also going to tell a lot about the true lipoma and other. Here, MRI of the forearm, that is going to tell you the lipoma. Here again, one can appreciate the lipoma. Similarly, one can appreciate the lipoma on the back via the MRI examination. Now, differential diagnosis of the lipoma is liposarcoma. This is a tumor, cancerous growth, hypernoma, and lipomatosis. I have already shown you the hypernoma and lipomatosis, but the only thing is one have to distinguish it from the liposarcoma. Here one can see it looks like lipoma, but actually it is a liposarcoma as it is spreading in size and causing pain. Similarly, hypernoma is there, the large tumor on the neck that is going to show you like this when it has been removed. Similarly, lipomatosis, the multiple lipomas on the different parts of the body, that is the lipomatosis. And here one is just going to see that two criminals just standing and trying to go for a big dacoity or a big robbery, but not. They are actually the beautiful flowers made by the God Almighty, and they look like that. Otherwise, they are just the flowers, and flowers never hurt anyone. They only give you the scent, the pleasure, the beauty of their color. And now, coming to the treatment, usually not necessary because unless becomes painful or restrict movement, I usually say to my patient that if the size increasing, if the skin overlying that is changing its color, if there is something coming out of it, if that is causing pain or any unusual feeling or unusual presentation, then we have to do something for the lipoma. Otherwise, it is just like benign, innocent, lying, not causing any problem and remains for decades and decades. Usually removed for the cosmetic reason if grow very large or for histopathology to verify tumor such as liposarcoma, and that is only when the size increasing, color is changing, pain is there, and discharge or any unusual change in the lipoma. Lipomas are removed by simple excision done under local anesthesia. 1 to 2% of lipomas recur after excision. So the possible side effect of this removal is scarring and bruising. And here one can see the lipoma has been excised in toto, and then the area, the gap from where this has been removed, one can stitch the margins to close that skin gap. A technique known as minimum axial extraction has resulted in less scarring. Liposuction, if lipoma is soft and with small connective tissue component, it causes less scarring but not suitable for the large lipomas. New method to remove without scarring by injecting compounds that trigger lipolysis and cause the lipolysis. Then it becomes fluid and one can easily make it out via the liposuction or by the syringe. Certain substances such as steroid or phosphatidylcholine are being used for lipolysis as these dissolve the lipid. Here one can see from the broad needle one can suck this subcutaneous fat tissue, and here one can see before sub liposuction and after liposuction. Prognosis and outcome. Lipomas are rarely life-threatening and subcutaneous lipomas are not a serious condition. Lipoma growing in internal organs are dangerous, like lipomas in the gastrointestinal tract can cause bleeding, ulceration, and all these effects are not because of the cancerous nature of the lipoma. It is usually the pressure symptom of the lipoma because of its size on the different tissues, and that causes bleeding and ulceration and painful obstruction sometimes, so that is malignant by location despite a benign growth histologically and in nature, but because of its position these are called malignant and causing the pressure effect because of their size and position. Malignant transformation of lipomas into liposarcoma is very rare. Most liposarcoma are not produced from pre-existing benign lesions. Rare cases of malignant transformation seen in bone and kidney lipoma, they can transform into liposarcoma. Then prognosis and outcome. Deep lipomas do recur than superficial lipomas, as complete surgical removal of deep lipomas is not always possible. So some remnant is there and that can recur to the lipoma again. Presence of the multiple lipomatosis is more common in men. Superficial lipomas can extend into deep fascia and cause complication. So, and to have the complicated axion because of their deeper involvement. Liposarcoma is found in 1% of the lipomas and more in lesion of the lower extremity, shoulders, and retroperitoneal area. Other risk factors for the liposarcoma are large size, more than 5 centimeter, with calcification, rapid growth, invasion into the nearby structures, or through fascia into the muscle tissue, as they are cancerous in nature. So the change in the size of the lipoma into the whether the size, the color, the bleeding, any discharge or anything, that is usually of suspicion, and one could go for the biopsy to rule out the possible of liposarcoma. That is the end of the lecture. I hope and I request that one is going to subscribe my lecture, and if you like it, you can share it with others, your friends, and if you don't like or have any question, please do not hesitate to talk to me about that. I will just give any question, whatever query or question is there. And thank you very much.